Recognized for 5 minutes.
Thank you, Mr. Speaker. What a great day for America. A victory for the American people. You know, last November, the American people loudly demanded the repeal of Obamacare, and today the House delivered. Earlier today, I outlined why the American people were so opposed to this legislation, and so tonight I thought I would remind my colleagues on the left as to why they rejected Obamacare. It was the employee mandate and the mandates on individuals that tax, penalize, and punish Americans who choose not to opt into a government-approved health care system. Maybe it was the $569 billion in new taxes, or the $2.6 trillion cost, $700 billion in deficit spending over the first 10 years when this law is fully implemented, and who knows what after that. But more importantly, it violated our Constitution and personal liberties. So earlier today, I asked my friends and folks back in the district who follow us on Facebook, Georgians I work for and I represent, I asked that they respond to us at how the legislation has already impacted them today. So we got a few of those responses, and Mr. Speaker, I thought I would share some of those. From North Georgia, it's Elizabeth in Rossville, said her health insurance premiums have already almost doubled. Jimmy in North Georgia said his health care premium is certainly more expensive. Brian said his health insurance just went up by at least 8%, and the cost of his mother's Medicaid Part D coverage has doubled. BJ in Calhoun, a health insurance agent, said premiums have risen and companies he represents are reducing or eliminating commissions. And then there's Jeremy in Ringgold. He was going to expand his business this year, but he was forced to put those plans on hold because of the costly and burdensome 1099 tax filing requirements that were required under Obamacare. It's because of these Americans that we not only repealed Obamacare today, but tomorrow we will also vote on a House resolution directing the committees of jurisdiction to begin working on legislation through a transparent process open to the American people that will embody free market principles that under many circumstances will foster economic growth and private sector job creation, lower health care premiums through increased competition and choice, ensure patients have the opportunity to keep a health care plan if they like it, reform the medical liability system to reduce unnecessary and wasteful health care spending, remove barriers that prohibit health care plans from being purchased across state lines, provide the states greater flexibility to administer the Medicaid programs, and more importantly, it will be policy that empowers Americans with options instead of the mandates coming from the federal government. And above all, our reforms will not infringe upon individual liberties. So, Mr. Speaker, I want to thank those tonight who on Facebook responded to us in helping us start that round 2 of the Obamacare debate. Today we voted to repeal. Tomorrow we begin the work to replace with free market solutions.